So good morning and welcome to another episode of Shaking Up the Vet Industry series of podcasts. And today I have the delight of chatting with Julia Ledger-Muennich, who is a lady that graduated as a traditional vet in Germany and then has ventured out to include more modalities, if you like, in her practice, including veterinary acupuncture, chiropractic treatments, and also traditional Chinese medicine. So welcome, Julia, and thank you for joining me today.
Good morning.
Thank you. So would you like to tell us a little bit about your journey to becoming sort of a more holistic vet, so having a more holistic approach to working with pets?
Yeah, so you said it. I graduated in Germany and started working in a big horse clinic, equine clinic there, and did my PhD there. And then I came over to the UK and worked here in a clinic as a conventional vet. And then I started looking out for more modalities that could help my patients. That set me off on a journey to go into chiropractic, in the veterinary chiropractic, which was lovely, but still probably didn't satisfy me enough to where I wanted to be, which led into learning about acupuncture, veterinary acupuncture. And for a little while, I was kind of quite content with that and thought, yeah, that is good. But I do believe that when you do acupuncture, when you do it the traditional way, which is what I did, so kind of the traditional Chinese way of acupuncture, and not the, I want to say, I'm saying this always, and I don't mean it quite like that, the way of cookbook acupuncture, which means that you're kind of, you say there's a stifle problem, and I put a couple of points in here for the stifle, or the Chinese way of thinking is, well, where does that come from? Where's the root? Where is the constitution? What else do we need to nourish? Where do we need to tonify? What is your pattern? Which is what I learned. So therefore, kind of, it took me quite a while to get my head into that. So I did the acupuncture. And if you do go into the Chinese way of thinking of how acupuncture works, which is very alien, to be fair, when you've studied, the physiology and anatomy in the conventional way of thinking for obviously quite a while and have used it for quite a while. But it did still lead me to thinking, okay, I need to know more. How did they do certain things and to help certain patterns? And acupuncture is a wonderful tool, but it does have its limits. So I then progressed from that and started learning about Chinese herbs and have done quite a few certifications of Chinese herbal medicine, veterinary medicine, and as well I've learned a lot about human medicine, because obviously that is where it derives from. And then kind of rounded things up there with Tuinya, which is certain Chinese massage technique that they are using, which is one of the pillars of the Chinese medicine, such as food therapy, acupuncture, Tuinya, which all kind of, I want to say, surround or create the traditional Chinese lifestyle of well-being. And so did a lot with food therapy, which I'm still doing to this day. Well, all these things are modalities I do, and eventually kind of ventured away from the conventional medicine and just specialize in traditional Chinese medicine, holistic medicine. Obviously, with, over the years, I've included a little bit of homeopathy, but I'm not a homeopath. Western herbs, I've done Western herbs, I've done certifications in Western herbs. So just kind of whatever really my patients need in order to have a holistic approach, to come from lots of angles, depending on what the patients need, really.
Okay. That's lovely. Thank you so much for, that in-depth explanation, because I think it's really lovely for people to know, people's backgrounds and just obviously, why they've gone that route and where they're taking it. So thank you for sharing that with us. It's lovely to hear. And, actually just sort of touching on what you've shared there, the food therapy, just so that people can understand that, what would food therapy entail? Because I think people know a bit more about acupuncture and a bit more perhaps about traditional Chinese medicine. What would be classed as food therapy in these instances?
So when we're talking about food therapy in the holistic way, so it all kind of is based again back on the Chinese medicine, or some of that actually, to be fair, if you think about it, is what we do naturally, or what we, let's say, should be doing naturally anyway. Food therapy can be, when, for example, animals are coming in it's often your small animals, so cats and dogs, that do have skin problems, that do have things like IBD, inflammatory bowel disease, that do have cancer. But as well with geriatrics, for example, that some dogs who have got metabolic problems that, can't gain weight, etc., etc. That would be when you're assessing and seeing what does this dog, cat, animal patient, what do they need? Very simplistically saying, obviously you can go for the proteins if we're talking about skin, or if we're talking about IBD, that some dogs, some cats can't cope with chicken, for example, can't cope with beef, and that we then search for different proteins that we can be using, seeing as well what patterns they show, what problems do they have, and depending on that, I will then search for things. Okay, how can we first of all make the whole food wholesome, i.e. how can we make it complete, so that they don't lack anything, but as well kind of working on, and that sounds a little bit more kind of, I want to say, holistic approach, but it's not, about what the energetics are, i.e. that can be very simple. For example, lamb is a rather warming meat. People generally, when you think about yourself, if people eat meat, when would they eat a stew, a lamb stew? That is something really hearty. So they would eat it in the winter. When we've got all the root vegetables available, when things are kind of convenient. So something warm, nourishing for the winter, when it's cold, when we're withdrawn, when we need to actually nurture our body with a little bit of warmth. That is how, just thinking about it, how we do it in the Western world as well. In winter, you want hearty food. So, along those lines, is that what means food therapy, and that is where we then look not only what is the environment giving us, but what is the patient giving me. So if we do have a dog that is, always a little bit cold, always a little bit, that is when you would be giving warming meats. When you do have a dog or a cat that's deficient, I would give something, or would advise for something, or at least include something that is nourishing. So in order that we get, that we tonify the body, that we kind of help to nurture, and then maybe get more ingredients that are of that property rather than something that is cooling.
Okay. Yeah, that honestly, as you say, it does make so much sense. That and absolutely, we do that. We do tend to kind of go for those foods, as you say, that are going to warm us up, that are going to comfort us, that are going to nurture us. And I know with my journey with Puss, we've had to look at certain we've had to look specifically at oxalates and proteins. Well, not me, the people around me that are actually her gardens, they've been looking at that. So it does make a lot of sense. And obviously it'd be, I'm sure, really good for people to know, because I know certainly people around me where they have said to me, well, my dog can't tolerate chicken, so we, they have to be careful what they give him. So that's, again, it's giving me a lot more knowledge for when obviously I liaise with them. So thank you for that. And obviously in terms of species, do you work with, cats, dogs, horses? Do you work with more than that, or are they generally the ones you see?
Yeah, I would say my main work will be cats, dogs, and horses. Absolutely. I do have, the odd chicken or the odd bird. I have to think about it. I've got farm animals. I do farm animals, although they probably, there's quite a few holistic farmers around here, which most of them, to be fair, would probably do to some extent their own, but I do that as well, but not to the extent. I do think my day-to-day work really would be, small animals and horses, i.e. cats and dogs and horses. Yeah.
And I know, I mean, obviously you're working with Puss, and I know a lot of people think for cats especially that actually they wouldn't tolerate things like acupuncture. And, Puss is actually very good. She's had acupuncture elsewhere as well. And, both times she's been exceedingly calm, if you like, I think, and has tolerated it very well. But it's been also about respecting her, hasn't it? And very much observing. It's been observing really her responses, knowing when she's had enough. And she's very good at showing that, of just shaking the needles out and going, right, that's me done. Do you find cats are more tolerant than people would think for acupuncture? Or because I know sometimes people have said to me, actually dogs are worse for having acupuncture, in terms of like I don't know whether it's just because they're fidgety or that kind of thing, but do you find certain species are better at tolerating things like acupuncture?
I have to say, no. I do think they actually all tolerate it really, really well. Yeah.
Yeah.
The key thing, one thing that you mentioned earlier, which I do think is the key thing, you have to respect them. You have to respect their fears. You have to respect that they're worried. You have to respect that, you know, that things when they come to me, usually it's a strange environment with lots of smell. And yes, of course, my treatment room is not like your normal surgery. You know, it's a very warm space, a very kind of, I think it's a very good place. I do feel I've got a good energy there. I like it. I like working in there. And actually, I would say 99% of, maybe 95, 99% of my clients find that too. You do have some that come with a really bad history, yeah, and those ones would be scared, but they would be scared no matter what. And then it's just giving them time. And that goes back to as well talking about cats. I mean, often when cats come to me, and you know, but as well when dogs come to me, they kind of come in, and then I usually say to people, just let them go, let them just explore here, go in there, you know, open the cage, or just let them off the leash, and then we talk about why the people are there, we talk about why, you know, why they're coming to see me, and how I can help them. And most of the time that already takes some of the tension out, number one, out of the people, because they feel heard, and we can discuss, and they can basically tell me where they're seeking help. And often it kind of takes as well, and therefore then tension out of the animal. And then going forward to the acupuncture, you said earlier, I thought maybe cats are not as good for acupuncture as dogs would be. To be perfectly honest, I do think it's a very individual thing. Most of the time, when you do allow the animals to express their worries, or when you listen, that sometimes can be as much as an ear change or the eye changes or anything, that you either, and obviously I've done this for a long time, so these subtle things kind of jump into my eye, and I think, okay, that was, you know, and that might be something that isn't that obvious. Yeah, it could be just a way that they suddenly move their body a little bit, you know, things like that. But I guess if people are very intuitive with their animals, they do see that, and then you just know it's enough, or you know not to go somewhere, or you know that you need to give them time, you need to let them approach it again. You know, the end of the day, sometimes when I first see an animal, I may not do as much as I think I would do in the first place, or maybe as even if I, you know, as much as I would like to do. But that always would mean that I'm trading off the trust that they put in me, i.e. they allow me to do certain amounts. So no animal gets sedated with me. They all do that kind of out of their, you know, sometimes we, you know, get a little bit of pate or treats, but they don't usually get any, you know, well, no, they never get any sedation. I've never done that, and I'm not going to do that, full stop, because I think that doesn't give me the feedback. Yeah, you know, some people would go as hard as saying you're violating, you know, you're basically taking it, but I think I want the feedback. I want them to tell me. And of course that may make it difficult if you do have a behavioral problem, a behavioral, you know, patient, but even then I do think in time they learn to trust, and then you can do more and more. I had just as an example, a dog that at one point I do laser acupuncture with animals that I can't touch, or that don't like to be touched, just to make them still, you know, make them feel, you know, that I'm not going to do that. I don't have to touch, but they still get the acupuncture treatment. And I've got, you know, a couple of that just will then go, and one of them in particular jumps to my mind, that I could hardly get near him to just laser, and that would have been without touching him. And you know, over time, then now I can absolutely needle him, no problem. Yeah. So, and that is the same with cats. And cats are obviously a lot more, I want to say, maybe a little bit, well, a lot more independent. Yeah. But if they allow you, they usually tolerate it absolutely well. And I always thought when I first started, you know, I thought, oh my dear, it's going to be meow, you know, don't touch me. But actually I've never had that. Yeah. So again, if you go in there with respect and you hear what they're saying, then I have, touch wood, never had a problem. But you mustn't overstep the mark. You know, I think that is quite important. And and don't trade in the trust that they put in you. I.e., if I say, okay, I've got 2 needles in, and now is maybe the time to stop, you know, that maybe next time I can do 4, I can do 6, I can do 8, you know. But if I now do the first time, I'm going to bombard them, you know, then they're not going to tolerate it next time. The next time they're going to be scared. And as well, I mean, just to say, I always try to needle, always, that they don't feel it. Yeah. So you know, sometimes that's not possible. But, you know, in a human world, when you look at human acupuncturists, that can sting quite a bit. if I would work like that, you know, with a human, you can say, sorry, that might be a bit painful, or they just don't say anything because people assume it's going to be painful. You don't have that with a dog, with a cat, with a horse, you know. So I will always try to needle so they don't feel it, because I generally, funny enough or not, I don't like needles very much. So I kind of don't want to inflict pain, yeah, because that kind of counteracts usually for what I'm trying to achieve.
Yeah, absolutely. And I mean, you know, you've hit on 2 points there, trust and respect. Totally, you know, and I certainly see that in what I do. Is I always say to people, you know, you've got to respect them, you know, it's about permission, you know, and yes, okay, I can communicate with person, I can communicate with animals and gain permission in a slightly different way. But as you say, you know, their body language, you know, I know with, you know, her body language showed where there was permission, and so I do know that's definitely very important. And the thing is as you say, the whole is what is the outcome, what the goal we're looking for, and the goal is for them to be able to have that treatment, feeling respected, feeling calm, feeling completely safe, as best they can, isn't it, in that environment. And the way to do that is to build the relationship, you know, is to build that trust. And we're never going to do that if we are trying to force something on any pet at all. So it is definitely about just working with them, as you say, and observing them. And I know with, you know, Pussy sessions, I am very highly attuned with her anyway, but even with her sessions, I've still seen those little, as you say, those little nuances, and I'm like, oh, okay, yeah, I can see that she's definitely showing that she can feel a change, she can feel something going on, or that she's had enough, or actually she's, you know, she's actually quite settled and she's, you know, calm in our company for both of us, you know. So there are those little nuances that tell. And the other point I just wanted to touch on is as you say, about owners as well, because I know in the work that I do, obviously pets being our mirrors and then picking up on our emotional states. You know, obviously, again, you know, it's not just the pets, is it, in a session? You know, people might be coming to this with I don't know what's going to happen. I don't know what she's going to do. Is my pet going to be in pain? Have I done the right thing? You know, there's going to be all these little questions and probably lots more going around people's minds, because they might not necessarily have experienced this kind of session before. And so the thing is that actually by, as you say, just letting that pet just have a little wander around with no expectations, they can just be, they can have a little look out the window, they can sit, they can groom, they can do what they want to do, and just chatting with that owner and just helping them feel calmer instantly. That pet is going to feel the change in that owner. Oh, right, okay, mummy or daddy's actually feeling a lot calmer now. Oh, okay, I can relax a bit more. So it's always going to help, isn't it? Because, you know, if they're thinking that in any way, you know, the session is going to cause any pain, which of course it, you know, won't be, but, you know, as soon as you're then going towards that pet, they're going to be like, oh, I don't know about this, you know. Instantly that pet's going to think, oh, hang on, you know, mummy or daddy's emotions have changed. So absolutely, it's a group bond, and as you say, it is as much in some respects working with the owner's emotions and how they're feeling to reassure the pet in that regard, but also obviously, as you say, working with the pet as well. So
absolutely,
you know, and thank you, because you've pretty much explained one of the questions, which was going to be sort of what do you generally do, you know, during a sort of a typical, in inverted commas, consult, because obviously we know, you know, every person that comes to you is going to be different, you know, the things they're seeking out for is going to be different, so obviously we know it's going to be different, and again, it's going to, as you say, be based on the pet's background. I certainly know with mine that they're, as you say, if they've suffered abuse in any way, you know, in their history, they might not want you to touch them, they might not want you close to them. So again, I love the fact that there's things that you can do with them that is on a distant level, so they're still getting what they need, but again, you're respecting that I don't want you to touch me right now, I don't know you and I don't trust you yet. So that actually then they start to build up that positive association of, you know, oh, I felt really good during that session and they respected me and it was all okay. And so then next time they're going to be like, oh, it's that lady again, she makes me feel really good, you know. And that's what you want, isn't it? You want to have that positive association, so actually they then get to that point where they really want to come, you know, and people say, hey, we're going to see Julia today, and their little tap, and you know, they're like, I'm ready, I'm by the door. So yeah, thank you for explaining that. And again, something that you touched on earlier, so elderly pets. Would you say, or see this, you know, what, well, I don't think I need to be, I don't kind of know the answer, but, you know, would you say that obviously what you do is really good for elderly pets as well?
Absolutely, absolutely. I do have actually quite a lot of geriatrics, which is, you know, I love working with the oldies. I have to say it is very, very, very rewarding. Of course, you know, it is very, very old, very, very, you know, when they are getting old, sometimes it can be kind of, you know, quite sad as well. And I kind of, you know, one of my patients, unfortunately, we lost last week, 1 month shy of 18. Yeah, and that was for a dog. And, you know, dogs usually wouldn't be to that age, a little bit different to cats, but that was quite remarkable. So, you know, I do have actually quite a lot of geriatric dogs. I think what the key thing is for them, obviously nutrition is always a very, very big thing, that they need to be nurtured and nourished good enough. To me as well, exercise is quite important, and that just as much as they can without overdoing it. And that can be sometimes, if people have got little trolleys, take them out in the park, let them have a look. You know, you could read some cats go with rucksacks, you know, that they can go out and just have a look, you know. So we do have some stimulation. I think that is really, really important. Of course, acupuncture will help them physically to be better. Often that helps as well with a little bit of mind clearance. Herbs will nourish them, you know, depending where they need nourished, you know, will tonify the kidneys and the spleen, and depending on what they need, really. But I have seen actually quite a lot of change, certainly when older patients came to me, that they would just, the life quality just increased. Yeah. And I think that's wonderful. You know, I love working with them, and I think there's so much you can do for them. You know, they're not just kind of aging. There's so much that they can still enjoy, maybe on a lesser energy level, but, you know, you don't need to run around all the time to enjoy, you know, the nice spring. So yeah, I love working with them, and it's really, really good for them. Yeah.
And it's very much, I mean, really sort of like an umbrella version of that is it's about quality of life, isn't it? You know,
Full stop.
the best it can be for them in every area of life, whether that's food, exercise, health, well-being. I mean, I know, you know, when I looked after a cat, who was 20, you know, one
Yeah.
of the things with him, it was, you know, his nutrition was obviously slightly different because of his needs. He had supplements to help with sort of the arthritis signs he was showing. He actually showed me that he wanted to go outside and just have a little look around, and he had this little routine of just going outside, licking the catnip that was in a pot, having a little wander on like a little circuit, coming back, licking the catnip and coming back in. You know,
Yeah.
and he was content with that. He was really happy with that. He'd never really been out in his entire life. So when he came to me, it was completely unexpected really for him to show me that, but I just knew it. I knew that he was saying to me, I just want to have a little look outside, you know.
Yeah.
And that's what we did safely. Obviously I made sure, you know, he had eye issues at that point, so obviously I was making sure that he wasn't in bushes and things like that that could obviously, you know, cause him eye damage or
Yeah,
anything
of
like
course.
that. But you know, he loved it. You know, he loved that little trip outside and back in again. So absolutely, quality of life is so important when they get to that kind of age as well.
Absolutely.
And what kind of conditions can you help? And are there ones that you see most often? Are there conditions also that you can't help that are not obvious? Like I know obviously surgery is not going to be one that you're going to work with.
No. But that, to be perfectly honest, those things would be pretty much the only thing where I would say I can't help in some way, shape, or form. Yeah. I usually, I mean, you know, I work always together with a conventional vet, yeah, or try to at least. I always request the notes of them just so I know what they've planned, what they've been up to. And I'm still fond of conventional medicine. I just don't use it. Yeah. So most of the time it's just not necessary. But if I ever feel that that is what's requested,
Yeah.
what is necessary for a quality of life, yeah, and that's what we had earlier, then of course I will work with a conventional vet and will ask them, or will say, talk to your vet about, you know, we may need to add XYZ now, and then you can go on a lower dosage and I can support them, you know, for side effects and so on and so on. So it kind of really, you know, has to work together. But I see, I would say everything that a conventional vet would see too. Yes, nothing. If some, you know, if cancer, I see cancer. You know, if there would be something to be needed surgically removed, that the conventional vet will do that. I have got a lot of cancer patients that will work with me. Some of them will go to chemotherapy and I can help with that, you know, kind of against the side effects. I've got a lot of patients as well who come for me for cancer therapies. Yeah, the herbal way. They don't want chemotherapy or conventional medicine. And then it is again about quality of life, you know, to enhance that. I have a lot of skin cases, a lot of mobility cases, IBD, you know, weight loss, behavior, you name it. It's just people seek help outside of the conventional area, and then you just got to see how much can you help, and can you help? Usually I can, you know, and then if need be, you can always top it up. I mean, you know, another word for holistic medicine is complementary medicine. You know, I would, of course, on my way, always say what complements what. And I would say the complement, like the conventional medicine complements me, because most of the time I don't need it. And if we do, then they can go back and add a little bit of the conventional stuff. But, you know, you have to just know when to use it and when not, and when you don't need it, if that makes sense. It's still,
Yeah.
I'm grateful that we've got it, full stop. You know, it's so there is, I'm not, you know, I'm not, often people think holistic, you know, vets are against conventional medicine. Not at all. Thank God we've got it. You know, it's important that we do work hand in hand. I really think that is, you know, because they specialize, the conventional vets specialize in whatever they're doing. Who would I be to not say, fantastic, tap into their knowledge? You know, that is, you know, and the same with me. I mean, I don't think the conventional medicines would know anything about what I do, or not in depth, of course. So they would need to leave that down to me. But if we work together, at the end of the day, it's always about the patient. And if we can get everyone on the table and everybody can give their best, then that's the best for the animal. That's how I see it.
Yeah, absolutely. That's what I was going to say, is it's all about the pet's welfare and their quality of life. And it is, as you say, about working together. You know, none of these interviews, including this one, is about dissing veterinary medicine in any way. As you
well,
say,
I'm a vet, you know, at the end of the day, I am a veterinary surgeon. It just because I don't use conventional medicine doesn't mean that I'm not fond of it. You know, again, why do you go into this profession? In order to help. And that's what we all try to do. To our best.
And the thing is, even though you don't use it, that's still going to be there, as you say. You know, you're going to be considering that of, you know, okay, you know, if what I'm doing is not quite working, or is there something that traditionally could work really well with what I'm doing?
Absolutely. And that is, I mean, that certainly is one of the bonuses, because obviously I've been there, I've done it. I can say, okay, you know, I would suggest, you've got now from the conventional side these and those options. I think this one is best, that will work best for him. Of course, I will consult. At the end of the day, the conventional vet is the one who prescribes it, but I can certainly discuss and say, this one I would prefer, talk to them about it. I can talk to them if necessary, you know, if need be, or if they want to talk to me, and then we just work hand in hand. You know, that is what it should be, really.
Yeah. I mean, it's, to be honest, it's no different, you know, as when, if I work with a human client, you know, I will never diagnose, I will never turn around and say to them that they should stop or take a medication. You know, I have inventories that I work with that are, I suppose, clinical inventories, in a sense, that, you know, may suggest that somebody might need to go and see their doctor, you know, perhaps if they've got anxiety or stress or whatever. And so I will, you know, if they do that inventory and it suggests that, then I will say to them, this is a clinical inventory. You know, what it's suggesting is, my recommendation is you go and have a chat with your doctor if that's something that you wish to pursue. So it's really, in some respects, no different to that. You know, I'm not going to, you know, I don't diss doctors, but for some people, medication isn't where they need to go. You know, they need to work on their childhood trauma or that kind of thing. So it's no different in that respect. And just touching on what you said, obviously, about speaking to the vet. So if somebody wanted to come and see you, can they self-refer their pet to you? I know that you always do contact the vet and ask for the history, because you obviously need to know what you're doing is not contraindicating what's already been done, etc. And knowing, obviously, the full picture of what's already been done. But can somebody self-refer? Can they just say, hey, Julia, I'd like to come and see you?
Yes.
Okay.
So that is what they can do. They can kind of come to me. I will always contact their primary vet. And that is something that I just, you know, I am not a primary vet. Yeah. I don't do surgery. I don't do bloods. I don't do conventional medicine. And that is where it's important that people have their primary vet. Yeah. That they have their care when, if, you know, if there was an accident, that they can take their animal to, and that will be helped. For my patients, usually I'm always accessible. Yeah. So they always, if there's a problem, people message me, you know, or email me, and then I can usually help, or I can say, you need to go and see them. Yeah, see your conventional vet. But I will always let the vet know that I'm seeing the animal, that, you know, what the history is. I will request it. And obviously, if there's further, and then potentially I will send them back and say, I would like, you know, go and have a blood sample, or, you know, whatever it needs then. But yes, people can ring and say, actually, I would like to bring my animal to you.
Yeah.
But I'm obviously, again, I'm not their primary vet. Yeah. I don't do any vaccinations, any wormers, any that. I mean, obviously some of the stuff I treat with different, you know, tools, but I'm not a conventional vet in that respect. Well, I don't do conventional, full stop.
Yeah. And thank you for explaining that. And I think, I mean, obviously, you know, I'm sure, you know, as you would say, you know, we would recommend to people to talk to your vet, you know, discuss that you'd like to come and see, you know, someone like yourself, because obviously it is all about maintaining that relationship with them, you know, and being able to talk to them. But I think it's also likewise, you know, good to know that actually, if for any reason their vet is not happy about it, or doesn't really you know, perhaps understand it, or doesn't want to recommend or do that kind of thing, then people still have that option of like, actually, this is what I would like to do, you know, and obviously then they can come and talk to you.
I think the problem there lies sometimes, and you do have maybe sometimes conventional practices that are not that fond. I think as an owner, it's always important to make clear it's not instead of. Yeah, it's kind of there really for the benefit of the animal. And therefore, I usually would not understand why they wouldn't be okay with that, if that makes sense. And maybe that comes from the misunderstanding that they think the people would come and not bring their pet again, you know, that it's an instead of. It's not an instead of, it is an as well as. And that's, I think sometimes if you make that clear to your vet, to your conventional vet, then it is a lot easier. You know, it's not disrespectful. It's not, you don't rate their opinion. It's just, I would like to have more, you know, pursue another route that, you know, and that person, that holistic vet specializes in it.
Yeah, absolutely. The same, you know, it's the same as us, you know, like if I went to my doctor with something and they say, all right, I want to prescribe you this, and I go, actually, do you know what? I think I'd like to see a homeopath first, because, you know, I'm definitely sensitive to pharmaceutical medications myself. So I tend to go down a holistic route, because I know that my body works better with more holistic, you know, natural medications. So homeopathy is probably obviously the most common one, but food therapy also, so working with certain foods for certain things. So in that respect, yes, as you say, it's not instead of, and even with the work that I do, I always say to people it's complementary. Please do not say to your vets it's alternative. It is not alternative, it's complementary.
No, it's not alternative. And I think that is, yeah, that is kind of the key thing. And the end of the day, because I'm a vet, I know when to say, you know what, this is not what we can deal with that. You now need to go and do X, Y, Z. We now need an X-ray. We now need a scan. We now need to do bloods. You know, I can do that. I'm qualified. You know, it's just, I don't do the stuff. So they will go back because I'm not your, you know, your conventional practice.
Yeah, no, absolutely. So thank you for making that really clear as well. And how do you find pets take to like the traditional Chinese medicine? Because I know with some of the Chinese herbs, they can be sort of quite bitter, that kind of thing. Like, how do you find pets take to the herbal side of obviously your practice?
To be honest, most of them, I would say probably 90% absolutely fine. You know, you mix it in and they take it absolutely no problem. There are a couple of tricks, you know, sometimes you have to start very little and then increase the dosage. Sometimes, you know, a little bit of pate works, or something that is kind of a little bit more smelly, like a bit of fish or a bit of tuna or something like that. Some people even use cheese, you know, so you can, or honey. I've got some that kind of roll it in a little bowl, and then they have like their treat bowl with their herbs before or after dinner, things like that. So there's various ways. There is as well, I sometimes do that, have my herbs pressed into a tablet form. You can do that. And if need be, I can get them done in a hydrophil, which is kind of a fluid that is slightly sweet with a little, it does taste a little bit, but if people find it's easier to do that, then you can do that, or you can just make out of and that is how it would have been done traditionally, to make a tea. Now, I usually use granules. They're kind of a little bit, I want to say, easier to handle. It used to be that people would boil their Chinese teas and boil them, and then add boiling water again and drink that, and then add boiling water again and drink that throughout the day. I now use granulated herbs, and so you can just kind of put that in a little bit of hot water and then put it over the food. So usually I would say it's actually pretty easy until it's not, if that makes sense, and then you have to find solutions. But most of them really do take it absolutely fine.
I mean, Puss, definitely, she has always been a foodie, if you like. So she's controls food in a sense, like that's her safety zone. And I know when you gave us herbs for her, you know, at first I tried to do it obviously with the warm water, and that didn't go well. And I just, and I ended up obviously just saying to her, how would you like it? These are the different options that we can work with. Is there any of those that you might like to try? Because, I really feel the herbs are going to help you. And she actually said to me, I want it in my food. And I was quite shocked at that, because that's not like her. Normally, like, she really doesn't like salmon oil. So if there's any food that's got salmon oil in it, she won't touch it with a barge pole, even if it's got the tiniest amount in it. So she's very, like, attuned, if you like, to ingredients of food. And so I was quite shocked that she said that she wanted it in food. But I did so. And yes, as you said, we did actually have to halve the dose. To start off when it's kind of remained at that level, but she's okay with that and she's happy with that. So that's what we're doing, obviously, with your assistance on that as well. And so, and she ate it, and she's still eating it. And, and even, and again, they're so intuitive, aren't they? Because I know with her, when we, we obviously got the possibility of adding in another herb, we tried it different ways, and she was like, no, I don't want it. And I trust that. And I trust that with her, that actually she's saying to me, I know the vibration of that particular herb, and it's not for me right now. Doesn't mean in the future, as you say, she might not want it, but right now she's saying that's not for me. Let's continue with what we're doing already. And we've then obviously carried on giving her those, and she's having it fine. So they are definitely very intuitive, and as I say, sometimes they surprise us. Like, we have our own expectations of what, or perspectives of how they might be, and that kind of thing. But actually, it just shows you that, again, when we're respecting them and we're working with them, she's taking it fine. So yeah, I just wanted to ask the question, because I know, having smelt them myself, they do smell quite bitter. And I've had traditional Chinese medicine before, and again, when I've not quite swallowed it quick enough, and you get that taste, and you're like, okay, a little bit. So I'm just aware that obviously cats don't, especially, well, I don't know if the dogs do, but I know especially cats really don't like bitter tastes very much. But she she works with it, she's having it, she's eating it, so that's really good. So obviously, just is one other thing I wanted to ask, actually, because we haven't really discussed it that much, because I know obviously time's coming to close quite shortly, is the chiropractic side of obviously the practice. So we haven't really talked too much about that. Where does that tend to come in for you in your consults?
So whenever you see me or whenever I kind of have an animal in, I wouldn't say I would ever do a chiropractic session without the needles or without Tuinia, because obviously all these kind of tools intertwine. So if I would have so I wouldn't usually go out and just do chiropractic treatment. I don't do that, full stop. To me, the chiropractic is another tool, just like the acupuncture, just like the herbs, just like the food therapy, that I will include into when I see it necessary. And you may not necessarily see, and sometimes it looks, I'm just stroking the animal, and in fact I'm just feeling 2 slight subluxations and see, do I need to give it a little bit of an adjustment. However, my chiropractic has never, since I graduated from it, has never been a kind of a thrust type treatment. So I would always be very gentle with it. You wouldn't see that with the horses. You sometimes see people treating and they kind of yank them and they really give a lot of kind of thrust into it. I don't do that, and I don't think, for me, it's necessary. I've never needed it. So, and that's, again, you kind of feel over them, and if there's a little bit of something that I feel would need moving, then I may do that. Sometimes you will find that I start needling, and then I go over the body again and feel, and depending on what it needs, kind of the hands, I want to say, they find what I need to do, and then I may put more needles in or not. It just depends really on the patients. But that kind of, I would just see it as another tool that comes in as and when I need it.
So a very integrated approach, basically, is whatever you're being presented with, whatever modality or therapy you think is going to be best, then you're going to work with that.
Absolutely. And at the end of the day, to me, is holistic medicine. Holistic medicine includes everything. Everything. And that may be conventional medicine if that is what's necessary. You've got to look at the whole picture. The more information you have, the more things you can bring together. That is what makes it holistic. Not just look at one thing. That is not how, in my opinion, it functions. It's the same as if you think, if we take it like that. If you think, okay, you've got a headache, the quickest thing to do would be to take a paracetamol or take an aspirin or something like that. The Chinese medicine, in my opinion, holistic medicine doesn't think, okay, we give it a painkiller. It would think, okay, why do we have a headache? Now, there could be a variation of reasons why that headache is appearing. That could be because you've got a slipped disc. It could be because you haven't drunken enough. It could be that you had alcohol the night before. It could be that you have got a sore ankle and therefore you're misaligned and therefore you get a headache. Yeah. And that's kind of 4 or 5 things which all have got a different root of the problem. And one of them would be, you need to detox. One of them would be just drink more. One of them would be you need an adjustment, another one you might need surgery.
Yeah.
So to me, yes, the painkiller would work, but it doesn't actually remove the root of the problem. And that is where the holistic medicine is coming in, and where you need to look at the bigger picture. And that's where those different modalities coming in, depending on what a patient needs, is this what I will provide.
Yeah, no, that makes total sense to me. Absolutely. I mean, interestingly, it's funny you say about that. I was speaking to somebody yesterday who said she got a headache. And one of the things we were sort of discussing was exactly like you're saying, really. And I said to her, well, have you drunk enough? Have you eaten enough? Oh, you still there? Okay, sorry, my friend is funny. So I'm gonna, because my phone's now saying good old low battery, so we're having fun with technology this morning. So one last message for owners. So if you had one last message for owners, what would that be?
The message that I would think is always important is look at your animal. Look at them and really look at them. So just see what's changed. And I know it's difficult if you see an animal every day, subtle things kind of creep in. Sometimes it could be as easy as say, okay, do a diary. I've seen, if somebody's changing shape, or now they can't jump up on a chair or on the sofa, on the bed, things like that. But as well, look at it with your connection to your animal, and then look at it as well as if it wouldn't be your animal. So, just try to, sometimes emotions we want to see certain things, and sometimes it can be we don't want to see certain things, that can be with the aging and the stiffness and so on. So I'd always try to see emotionally involved and emotionally not involved. And then I have that as well when animals come in, it's like, yeah, but he always moved like that. He's always moved like that. That doesn't make it right. Yeah. Just because he always moved like that doesn't mean he's not lame. It does just mean that he's always moved like that. Yeah. Those are the things that I would really think, look at your animal critically and trust your gut feeling. That is another one. Just trust yourself. And if you're not sure, go and see someone and talk to them and see if there's anything you can do to help. Yeah. But I think gut feeling is a really good and important tool that I like to tap in with my patient owners, because they usually know their animals, and then I can filter out what I think is important to me at this moment, or something that is just good to know, and then we can maybe utilize it a little bit later.
Yeah, absolutely. Well, thank you so much for that, and
you're very welcome.
Thank you for chatting with me today, because it has been really interesting, and I hope everybody that listens or watches to this again obviously feels the same. So just before we finish up, where can they find you? So your website, your contact details, are you on any directories that they can find you on as well?
Probably internet is probably the easiest, i.e. website probably is the easiest. There's a telephone number there and an email address. So email is probably best. Usually then Tamara, my lovely PA, can send out informations, and that is probably easiest. I think I'm on the acupuncture, veterinary acupuncture. I think I'm on their directory, and I think I'm on the British Veterinary Herbal Association directory. But probably the easiest, just to Google Chirovet, Chirovet Kent or Chirovet Wales, depending where you are, and then kind of contact us, and then we sort things out.
Okay, lovely. And so just for the viewers or the listeners, so Julia's website is www.chirovet.co.uk, or obviously the Wales one I think is chirovetwales.co.uk, but just Google that. And her mobile is 07513 034567, and then her email address, where as you said earlier, you'll meet lovely Tamara, is chirovetkent@gmail.com. Not sure of the one for Wales, but again, if you go onto the Chirovet Wales website,
you could always email that one. That's okay. That will all come to us.
Yeah. So thank you for your time. Thank you for your energy and your knowledge today. It's been lovely to have a chat with you. And yeah, thank you very much for being part of this series as well. So much appreciated.
Thank you very much. All the best.
Okay.
Bye.